It's our mission sorry. It's our mission to identify and address the diverse healthcare needs in our community. We provide grant funding to nonprofits that address health and wellness and work with local agencies to promote collaboration in addressing the health needs of our community. Just before we get started, a little housekeeping. So if you could please mute your mics during the presentation to decrease bounce back. If you have questions, you can put them in the chat. And then if there's time at the end of the presentation, then you may unmute and ask your questions at that point. This presentation will be recorded. We just started the recording and will be shared later. So we will go ahead and let you know when the recording stops if you want to ask questions at the end. Thank you to our partner in today's Lunch and Learn, the American Heart Association. They have a presentation today about how to keep ourselves, families, and communities healthy. Today, we're talking with Tracy Behnke. Thank you for joining us, Tracy. Tracy currently serves as the Executive Director of the American Heart Association, overseeing community education, impact, and fundraising work across the Akron, Canton, Youngstown, and Mercer, PA communities. Tracy joined the American Heart Association in 2013 and became Executive Director in 2018. Tracy and her team are tasked with spreading awareness and raising critical funds for America's #1 and #5 killers, heart disease and stroke. I will let you get started with your presentation, Tracy. Thank you.
Awesome. Well, good afternoon, everyone. And thank you, Donna. And thank you, everyone, for having me today. Donna, can you give me just a quick thumbs up that you can see the PowerPoint on the site? All right, awesome. I always like to make sure. So thanks, everyone, for having me today. We are exactly halfway between Heart Month, and just a great opportunity and a great time just to share some things about the American Heart Association, what we're doing, and just educate us all today a little bit on how we can first start with ourselves to make ourselves healthy, make those healthy choices, and then really how that integrates with our family and our communities as well. So before we get started today, some of the things that I'm going to talk about today are very specific to heart health before we dive into kind of what we can each do. And this is one of my favorite videos. So during Heart Month, a lot of our focus and efforts is on women's heart health. And so what we'll learn is that heart disease is the #1 killer of all women. So it actually kills more women than all forms of cancer combined. And the one thing that we're finding out now is that heart disease is getting, unfortunately, younger and younger to women in our community. So I'm going to start off with a quick video today, really just sharing some real stories from some real women, and just we'll get to start with a little mission moment today, which I need to do one thing real quick. I have to stop sharing and share again because I did not share my sound, and nobody will be able to hear my video. You'll learn that the hard way.
I didn't have any risk factors. I didn't have any family history of strokes or heart attacks. I had no history of heart failure in my family.
They were like, how are you 30 years old having a heart attack?
For me at that time, I was only 29 years old. The least thing in my mind was having an issue with heart health.
I think there's a misconception that it's only older people that get heart disease.
That's something that we kind of think of as a man's disease. Like, why would this happen to me? Like, of all people,
Even though I knew that heart disease was in my future, I was thinking heart disease was 20 years in my future.
I initially thought that it was a panic attack because I didn't know.
It did not occur to me in the slightest that I would have heart failure or a stroke. I wasn't educated on the signs and symptoms.
I don't think I took those measures early enough because I thought it was an old person's disease.
And now I sit with a dead part in my brain because I had a stroke and I had heart failure right after I gave birth to my daughter. I just want young women to, yes, be ambitious, go after your goals, but focus on your health.
I remember speaking to my husband in ICU, and I told him, my life will change. My life is going to change for the better. And I have done that. You can do anything you put your heart and mind to, and I am living proof of that. We are strong. We can do it. We know we can do it. I'm just ready to take on the world. That's how I feel now. That's what it did. If anything, having a heart attack made me that much stronger.
So no matter how many times I see that video, I still get emotional because it is just something that is very real and very scary. I know as we sit and think about this presentation and just things like that, think about that person that you may know in your life that's been affected by heart disease. I always like to say, like, what's your why? And why are you here today listening to this, just really feeling out what you can do to make that change in your life. I always say start somewhere, start small. So you'll be hearing a lot of that today. It doesn't have to be something grand, but the things that we'll talk about today can be some simple measures for your life to take from that perspective. All right. So here's just a couple things again to know. So heart disease is the #1 killer of women, claiming more lives than all forms of cancer combined. 1 in 3 women will die from heart disease. So I always look at that, and in my family, it's very true. My grandmother, mom, and myself. My grandmother had a stroke when I was in high school, a couple of them actually, and then about a little over 4 years ago, my mom actually passed away from cardiac arrest. And so in my family, I'm trying to be that person that is changing the way that we think about heart health in our family. The other thing is that almost 50% of African American women over the age of 20 have some form of heart disease. So again, just that staggering statistic of how things are getting younger and younger, just based on lifestyles. We talk a lot at the Heart Association about social determinants of health, just all of those things that we're trying to make sure that that access to healthy choices are not only the easy choice, but that are accessible to everyone. So what can you do about it, just from your self perspective? So knowing the signs and symptoms. We're going to go through these on the next couple of slides about the heart attack and stroke symptoms, and even ways that they differ between men and women, because they're not the same for everybody. Again, awareness is critical. Knowing your numbers, knowing your blood pressure numbers, knowing your cholesterol numbers, your blood glucose, blood sugar, all of those numbers are so very important to know, to then know your risk for heart disease. Know your family history. A lot of the things that we're going to be talking about today are preventative measures that you can take. The one thing we can't change is our genetics. So how do we make sure that we're changing, what we can, knowing that sometimes our family history may have the best of us. And then taking charge of your health. So we're going to talk through physical activity, healthy eating, controlling your blood pressure, never picking up tobacco products, or if you do, working to quit from that perspective, and really just focusing on those aspects of our life that we can each control. So we'll start with heart attack symptoms of men versus women. So as you can see on the chart here, so the nausea, vomiting, the jaw pain, the neck pain, back pain, those are very similar between men and women. Shortness of breath is also another one that you'll see a lot of. For men, it's that kind of squeezing or tightness in your chest. I remember always seeing an infographic when I was younger, and it was, a man grabbing his arm. And that was really what you thought of when you thought of somebody visually having a heart attack. Some other things for women as well, some specific things that are additional signs and symptoms are circled here in red. So chest pain can be there, but it's not always for women. Pain or pressure in your lower chest and upper abdomen area. So a little bit more so than just that tightness in the chest. It's kind of more of a lower perspective. Fainting, indigestion, extreme fatigue. Again, you can look at some of these things and say, they can also be stress related. They can also be, signs of anxiety or a panic attack or things like that. The biggest thing that I always tell people is know your body, listen to your body, and call 911 when necessary. So these are the heart attack signs and symptoms. The next thing we'll talk through briefly is just the FAST acronym, which is the, what we like to say is just a quick reminder for putting out stroke signs and symptoms. So the big ones are if someone's face is drooping, if their face starts drooping or they start slurring their speech, ask them to raise their arm on the same side where their face is drooping. And they may not be able to raise their arm whatsoever. If they start slurring their speech, if they're having difficulty finishing sentences, or you just notice these things just visibly that aren't normal, then it's time to call 911. Again, on the chart here, there's a couple additional things from a woman that could be an additional stroke symptom when a stroke is occurring. Just general weakness, disorientation or confusion, that fatigue, and then some nausea or vomiting as well. So strokes are a lot more visible from that perspective. The big thing, again, paying attention to your body and knowing when it's time to call 911. We have been working very closely with legislation in both Ohio and Pennsylvania on a stroke registry, on telephonic CPR for 911 responders and 911 operators, really trying to make sure that we are setting up folks who are having a heart attack or a stroke to be able to have the best care possible when they get to a hospital. So being able to connect them to whatever testing they need to have or programs or things like that, so that we know what's happening as soon as we get there. The worst thing that can happen is somebody is having a heart attack or a stroke and decides to drive themselves to the hospital, not only putting yourself at risk, but those others as well. I've heard stories of like some women and some survivors that I know that are like, oh, I thought I had the flu, so I finished my work day, took the kids to this activity, and then I just went to the urgent care to get checked out and realized that they had a heart attack or were in the midst of, having a stroke or things were happening to them. So the signs and symptoms are there. Just be sure to pay attention to your body from that perspective. One other thing that we'll be talking about today is blood pressure and the importance of knowing your numbers and the importance of a good blood pressure range. So at the Heart Association, we say that a normal blood pressure is 120/80 or less. Once you start getting over that, it can become elevated, or then in one of these other three areas where they can become extremely dangerous from that end. So hypertension and blood pressure is the number one risk factor for stroke. So just being very mindful of those numbers. I always say, don't trust the first reading sometimes. I think when I go to the doctors, kind of setting the stage of, okay, you go to the doctor, you're in the waiting room for, a little bit of time. The first thing you do is get on the scale. And then they're like, okay, let's sit down and take your blood pressure. And so, from that perspective, your body's not calm. Your body is not in that state where it's relaxed to where you're getting, may not be getting an accurate reading. So if it is elevated above what it normally is, ask someone to take it a little bit again later, or, be able to take it in another situation or another scenario from that end. The other things that can help control blood pressure are diet, exercise, tobacco use, all of those kind of things that, again, just tie into overall health for ourselves as well. This year for Heart Month, we're really focusing on the theme of reclaiming your rhythm. And so what that means is, asking not only women, but families to reclaim their rhythm. It's been a long 2 years for everybody. We've all been working from home, homeschooling, the pandemic, just kind of everything going on for everyone. Our healthcare workers have been through so much. And so what can we do to just take that time and reclaim our rhythm? So really working on ways to mellow out and reduce stress, whether that is meditation, which we'll talk about in a little bit. Again, fueling your body properly. Really we say food and movement is medicine. So how can we help from that perspective? Moving to the music. So I come from a very musical family. I didn't get passed on to me, but both of my parents were very musically inclined. And so anytime there's music on, it just kind of lifts the mood from that perspective. So again, if you have a couple minutes, put on your favorite song, kind of tune everything else out and just listen to that to change that, change your mind frame and your mood. The other is just feeding your soul and just trying out some new recipes. I think those are the biggest things too. We have the Heart Association has just a ton of recipes, a ton of things that you can look at and really just get that health aspect and adding more color to your plate. Again, staying on beat with blood pressure and knowing your numbers. And then we are asking folks to learn hands-only CPR. Compressions from hands-only CPR can triple the chance of survival for somebody going into cardiac arrest. We've kind of enhanced the narrative a little bit around CPR and knowing that the compressions are such a core component of it, that if compressions are started, once they see somebody having a cardiac event, then again, triples their chance of survival if the compressions keep happening. A lot of times, we're working with high schools to ensure that high school seniors, by the time they graduate, are trained in hands-only CPR. It's not a full certification, but it is something where we're trying to train thousands and thousands of lifesavers in our community every year. Nobody goes to the hospital and is like, okay, I think in 12 minutes, I'm going to have a cardiac event. These things are happening at home, at school, at the mall, like places where people are in the community. And the more people that we can train, the better. and knowing that the compressions do help significantly. I know, the breaths were kind of the first, the rescue breaths. People were cautious of that before, and especially now with COVID and things like that happening, the chances of somebody doing that are probably even slimmer than they were before. So we just want people to be educated and know, hard and fast in the center of the chest, singing Bee Gees Staying Alive or Baby Shark, because I said Staying Alive to a group of high school kids and they looked at me like I was crazy because they had no idea who the Bee Gees were. So I'm trying to, think of new songs and things like that that are relevant, that still have that beat, and just giving people the confidence to know that they can do that. So we're going to dive into, what a culture of health is. And so really at the Heart Association, we think that it's ensuring the opportunity for everyone to be able to have access no matter where they live, work, learn, play, pray, and heal. So why does something like this matter? So unfortunately, heart disease remains the #1 killer in America. Stroke is number 5. Stroke is also the #1 when it comes to disabling somebody from having a stroke. So we're still in that realm of, everyone wants to be #1 at something. This is not something that the Heart Association wants to be #1 at. And unfortunately, we did see a decline, but things are increasing again, and we're still staying on that trajectory of still being the #1 killer in America. We have made some great progress with the continued education, but there's still such a long way to go from that end. The other reason is, truly because overall life expectancy is declining. I have a slide a little bit later on that talks about zip codes, and where you live should not matter how long you live. There are some areas where zip codes are 3 miles apart on a map, but have a 25-year life expectancy difference, just because it is the access to things, the healthy food and beverages, just all of those things that come into play are not accessible for someone that lives there. And so what we're really working to do is, how do we remove those barriers, working with our community partners from that perspective. So you can definitely see we were, again, kind of going up in that good trajectory of overall life expectancy, and then it's heading down. Another thing the Heart Association is really focusing on is healthy years. So if you live to be 70 years old, our goal is for all 70 of those years to be healthy for you, and not 50 years healthy and 20 years of declining health. So we want to make sure that we're keeping those things as relevant as possible. These next 3 slides really show kind of where we are or where we've been going as a society as far as the percentage of obesity of adults by state. So this is a BMI of 30 plus. As you can tell, there was actually a 0 to 10% of the population back in 1990 in a lot of the states. Mississippi and the southern states have always been a little bit higher from that perspective. Kind of Ohio was in that 10 to 15% range from that end. So from 1990 to 2015, you will see that there are now no states in that 0 to 10% of an obesity range. And so this is just how it's looked over the course of 25 years. A majority of the states now report greater than 30% of obesity across the country. So this is in 2015. Again, those southern states, West Virginia, things like that are already above that 35% of obesity from that end. And there's not really any states under 20% at this point in time. So then we move to 2021. There is no longer anything less than 20%. There's that 0 to 10% range is gone, even up to 15% is gone. So there are no states in America that have less than a 20% obesity rate, where compared to 30 years ago, we did have some of those states. So now kind of Hawaii, Colorado, and DC are those kind of top states for health, and lots of reasons for those. But I just keep thinking about, just how life has shifted to convenience, to getting things done as quick as we can, to not really thinking, I feel like when I was a kid, we would have family dinners and we would do all those kind of things. Now I feel like everybody's just running a million miles a minute all the time. And so portion control, portion sizes are getting bigger at restaurants, just all these things that are taking place to really where it's putting us in this perspective of really being more an obese nation from that end. And, this also leads to inactivity, which is all those kind of things that we think about when it comes to not making the healthiest choices and where we can go from here. So thinking of, again, kind of like I just mentioned, everybody's moving pretty quickly and kind of why those numbers where they are. So the benefits and barriers to a healthy culture. So taking a look at a day in the life of a traditional American family, if you will, or a typical American family. So you wake up early in the morning, 6 a.m., maybe lack of sleep from the night before. Sometimes a healthy breakfast isn't an option. It's kind of, again, whatever we can grab and go as we're running out the door, not only for our families, but for ourselves as well to get the day started. Thinking about back in the 60s, more than half the kids walk to school every day. Now less than 1 in 10 do. And that's for a variety of reasons. I know when I was in school, we had neighborhood elementary schools, and now kind of all of those have closed down and they've moved to different areas. But just thinking, that fresh air in the morning, the things like that really aren't taking place as often anymore. Communities are designed for cars. So, pre-COVID, when everybody was working in their office, the average person spends about 45 minutes per day in traffic. And I feel like this is my life in a nutshell when it comes to work and things like that. But you come to work and you sit. We're all very sedimentary right now. A lot of Zoom meetings, a lot of these kind of things where we're back to back to back. And they are saying that sitting is the new smoking because that sedimentary lifestyle is really catching up with everybody from that perspective. So just coming into work, sitting for, anywhere from 7 to 10 hours a day. And then quick dinners, again, picking kids up, picking family members up, being caretakers, kind of running around as much as possible and getting the most done that we can every single day and kind of checking off those lists. But just thinking, need to make a quick dinner. A lot of times those quick dinners may not be the healthiest options. The other thing is, thinking about screen time for all of us. I think I've spent more time looking at a computer or my phone than I ever have in my life. And so really just thinking, kids spend about 3 hours per day watching TV and about 5 to 7 total on screens. So again, whether that's school, whether that's work, things like that, of just making sure that we're connected, always connected, I feel like. And then of course, having to check that one last email or social media update or things like that before we go to bed. So this can look familiar to a lot of people. There's so many parts of our daily lives that truly interfere with what we can put forward to being our best health from that perspective. The good news is that so much of heart disease and stroke can be prevented a majority of the time by making these healthy choices and really being mindful of those healthy choices and putting that in the forefront as a priority for ourselves and our families. So we're going to be talking about building kind of your own culture of health. And again, starting small, starting somewhere is so very important through the 7 things that the Heart Association likes to call Life Simple 7. Not saying if you don't do all 7 of these things today or tomorrow, that it's kind of a failure from that perspective, but just knowing that, again, what's one thing that we can all do today just to keep ourselves healthier, or to make that healthy choice and be that advocate for health for ourselves. So we all know that eating a healthy diet is extremely important. So, really, again, food is medicine. What we're putting in is helping us get through the days, is helping us do the things that we need to do. It's just putting that extra time and effort into that for ourselves. Going for a simple, I don't even want to call it diet, but just simple eating healthy, not a fad diet, to really nourish your body and bring out the best of yourselves. Eating more fruits and vegetables, whole grains, poultry and fish, lean meats, including red meats. I know, again, there's some things that is like, oh, we can't have any red meat, or we can't do this. Everything truly in moderation. So eat less, don't totally eliminate or don't eat certain foods. Just eating less saturated fat, sodium, fatty red meats, sweets, and sugary drinks. The one thing that I always like to mention is we think of sugar sweetened beverages. The average child drinks enough sugar per year to fill a bathtub. So when you put that in perspective, it doesn't even include cakes, ice cream, all the sugar sweets that we're eating. It really is just things that we're drinking for the average child. So a bathtub, no matter how big it is pretty big. And so just thinking about how much sugar is being consumed from the youth, that's a little scary, and can tell why things are getting, why those habits are starting younger and younger as well. Again, cooking more at home. I know we've all done a lot of that. Planning ahead at restaurants. I think I'm one to look at the menus just to see what they're going to have, so that when you're there, it's not so overwhelming. And then the heart check mark at your grocery store. So, we have worked through our science departments with a lot of different organizations in the food industry, and just talking to making sure that they're meeting the guidelines of the American Heart Association and what that means. So if you're at the store, you'll see things on kind of lower sodium items, very lean red meats, things like that. So there are a variety of options. They're not just on the fruits and vegetables. They're definitely on some other shelf stable foods and things like that in the community as well. The other thing too, when we think about just, kind of how the obesity rates and things like that have skyrocketed, beware of serving sizes. I feel like when I'm from an Italian and Lebanese family, so everything is more food, more pasta, eat as much as you can. It's our sign of love for everybody. And so just thinking that I don't think serving sizes existed when I was a kid, and you just kept eating. And so when you think about going to a restaurant or even ordering just meat from the meat counter, things like that. So one serving is about, I'm a very visual person, so it's about the same size as a deck of cards is one serving of lean meat or poultry. So you figure if you go out to a restaurant and you get a 12-ounce strip steak, it's actually 4 servings that we should be having. So again, just being mindful and thoughtful of what that looks like, that a 3 to 4 ounce serving is kind of what we're supposed to be having from those meats in that perspective. So I'm like, okay, so I have 4 servings of meat, just in one meal for dinner from that end. So it's a little, just a little something to think about. Again, taking away kind of those little nuggets from this presentation. So exercising and maintaining a healthy weight, we all know that that's so important. The AHA recommends about 30 minutes of moderate intensity aerobic activity at least 5 days a week, which is about 150 minutes total. So, when we think about what we can break that down into, not saying it has to be 30 minutes all at the same time. Sometimes we can't find 30 minutes to get away to do something for ourselves. If it's 3 10-minute blocks, if it's 2 15-minute blocks, whatever you can do from that end. And again, it's not saying that in order to exercise and for it to be meaningful to your heart health, it has to be training for a marathon or has to be, doing something crazy from that perspective. It really is just breaking it down to that 150 minutes per week. If you are adding strength training, things like that, 2 days per week of that is something that's extremely beneficial. And again, doesn't have to be hours and hours and hours in the gym every day to be beneficial. The one thing that we know is smoking is the largest cause of preventable death in the U.S. If you do smoke or you do use any tobacco products, finding a way to quit is the best thing that you can do for yourself and your health, and it has immediate health benefits. So in the first 20 minutes after someone quits smoking, the blood pressure and heart rate begin to recover from the cigarette-induced spike. After 2 weeks to 3 months of smoke-free living, the circulation and the lung functions actually begin to improve just in that short time frame as well. And then 1 year after quitting, a person's excess risk of coronary heart disease is actually reduced by 50%. And then after 5 years, your risk of cancer of the mouth, the throat, the esophagus, and the bladder actually cut in half. And your risk of cervical cancer and stroke actually return to a normal rate. After about 15 years, the risk of coronary heart disease is actually the same as a non-smoker. So knowing that is just something that we say, it really is that number one controllable risk factor, And a lot of things that we're doing at the Heart Association now is working so that our youth never start smoking. And not only smoking traditional cigarettes, but e-cigarettes and vaping is something I feel like we took a, kind of turned our head to the side a little bit years ago when we were starting to see the downward trajectory of traditional cigarette smoking. And then vaping came into play and really just threw everyone for a whirlwind. So now there's so many young people that are starting to vape, which they can do at home, at school, things like that. Like there are so many things, they don't have the same smell, the things like that as traditional cigarettes. So they are, and the devices that they're using could be, they look like key fobs, they look like Apple Watches, they look like all of these things that are everyday items, to where they are focusing on the younger kids, to helping them kind of sneak around and start that. And there are, while we don't know the long-term effects for e-cigarettes and vaping devices and things like that, we do know that there are addictive benefits or addictive things in it that then can lead them to other things down the line. So we're really working hard to try to get kids to understand that aspect and to get them to never start smoking, as opposed to trying to get them to quit on down the line. Again, I know we talked about managing blood pressure, cholesterol, things like that, knowing your numbers. Cholesterol levels should be less than 200. Your LDL, or the bad cholesterol, should be less than 100. Fasting blood sugar should be no more than 100 as well. So again, knowing your numbers, getting those tests, making sure that you're going to your doctor, especially even if it's just for your physicals every year, to get those numbers read and known. One thing that I feel like we all can relate to is just, certain amounts of stress that are taking place. And truly, they're really saying that stress can be a health epidemic. Thinking about how tobacco and vaping is right now with our youth, just stress and stress management are things that, we're really seeing, again, just come to the forefront. It really sets off a chain of responses in your system, and it is linked to heart disease, diabetes, substance abuse. Chronic stress has been linked very heavily to unhealthy lifestyle choices that can then lead to high blood pressure. And it's more likely affecting your health more than you know, especially if you suffer from headaches, neck aches, back aches, sore muscles, feeling tired all the time, trouble sleeping too much, feeling anxious, feeling depressed. A lot of those things can be caused and linked to stress. And so really some things that we're talking about now is really what it is to be resilient. I feel like as a country, we've really shown that, but just the ability to withstand, recover, and grow in the face of stress and changing demands. I feel like they're definitely changing each and every day from that perspective. So withstand is being able to deal with that challenge. Recover is being able to bounce back. And then to grow is to be able to thrive in that face of adversity. Some things that we have been really focusing on at the Heart Association is, meditation and helping with that resilience. And not even 10 minutes of meditating or, listening to something, even taking 5 deep breaths helps reset your nervous system and can really help put you in a state of just calming that nervous system down, bringing your heart rate down in a natural way, and allowing yourselves to not only feel a little bit more calm and better at that moment, but also helping to treat anxiety, depression, and lowering stress. Some hacks to keep you less stressed, getting enough rest, and getting enough good rest. It makes you feel less, it does make us all feel less likely to crave those unhealthy foods. So sugary foods, fatty foods that provide that quick energy for us. So making sure we're getting enough rest during the day can definitely help from that perspective. Not needing to turn yourself into a pretzel to meditate or take those deep breaths, even if you're sitting at your desk or even sitting on the couch or wherever that might be. It's just making sure that we're having being able to just take those couple of deep breaths for a few minutes. Taking, like I said, a couple minutes, again, doesn't have to be anything dramatic. It's just starting small and starting somewhere, I think, is really important. And truly don't overlook that emotional and mental health. You know, we all have our support systems and things like that, but if you need help, get it to manage the stress, the anxiety, you know, if there's grief, depression, things like that, really getting help for yourself is helping those that we love as well. So a couple of things, you know, I think we all have heard fad diets, all the things that are happening from that perspective. And I wanted to just have a couple, just take a second to go through a couple of these things, and are they heart healthy? So I feel like this one was a little while ago, but coconut oil, there was a fad for a while. I feel like I might have bought like a Sam's Club size jar of coconut oil because I thought it was healthy for me. And I think it's also sitting in my fridge or the cabinet, because I don't think I've ever used it for anything. But the Heart Association says that, you know, that coconut oil is not recommended. There are some other better oils that you can use for things that have those benefits, things like that. And just making sure that when you're thinking about what oils to choose, choosing something that is just low in all the different kind of fats and things like that to use from that perspective. So we at the Heart Association do not recommend the coconut oil. So fat, we know that there are good fats and we know that there are bad fats. So your body does need fat, but some are healthier than others. So unsaturated fats, like those found in avocados or fish or olive oil or nuts, do help lower that bad cholesterol for you. And saturated fats, like those found in cheese, butters, heavy creams, and kind of more fatty or red meats, raise your levels of bad cholesterol. The trans fats that are found in those things like donuts, cakes, those topical oils, those again raise those bad cholesterol numbers for you. So some are healthy from that perspective. So again, just knowing the difference between the healthy and the non-healthy ones. This is always a good one. So I went and talked to a college class and I was like, can you catch up on your sleep? Is it something where, you know, you had a long week and it's the weekend, and can you catch up on sleep? The answer is no, it's not possible to really catch up on your sleep from that end. But constant sleep is important to your heart and your brain health. Each aiming to get between 7 and 9 hours per night, and catching up on sleep on the weekends may not help anything if you're not getting that normal level of sleep through the week. So just regular sleep is healthy from that perspective. This is always a toss-up. So fresh vegetables or frozen vegetables, kind of which is healthier. And the good news is both have the same vitamins and minerals that our body needs. The big thing to look out for is when you're looking at frozen vegetables, if you have a steamed fresh bag of broccoli with garlic butter cheese sauce, that has those added things that are, you know, kind of not heart healthy from that perspective, and those additives that are in there. But overall, they do have the same, like I said, vitamins and minerals that our body needs. Knowing being in, you know, Northeast Ohio, Western Pennsylvania, sometimes fresh fruits and vegetables are hard to come by. I think I get like 3 fresh strawberries in a container that actually are like edible when I go get, you know, some from the store. But just really knowing that there are benefits for both. Just making sure you're checking the labels on those frozen ones to make sure that there's not any added sodium, any sugars, any sauces, things like that from that end. So both have the same. Something that I recently learned in the last few years was the correlation between oral health and good oral hygiene and heart health. So it turns out that oral health and heart health are linked. Gum disease, treating gum disease may help lower blood pressure actually for people at risk for heart disease. So again, just like it's very important to go to your doctors to know your numbers, things like that. Regular cleanings, oral health and oral hygiene is extremely important, and is another thing that, you know, from a risk factor perspective that we can lower from that end. I am very guilty of this. You know, when we are, I feel like it takes hours and hours to cook a really great dinner. It takes about 7 minutes to eat it. And so making sure that, you know, when we are eating slowly, we are less likely to become obese or develop a metabolic syndrome, which is truly a cluster of heart disease, diabetes, and stroke risk factors. So enjoying our food, being mindful when we're eating, not kind of grabbing a bag of chips and sitting down on the couch and just kind of just keep eating them, which I feel like everyone's guilty of doing at one point or another, myself included. And then realizing I just ate 14 servings of chips in one sitting and didn't mean to from that perspective. So again, eating food quickly is not healthy for a lot of reasons. Enjoy the time that you're putting into the meals, even if it's somebody else cooking it for you. And then salt. So again, we talk about salt all the time. So sodium is truly a mineral that is essential for life. It helps is regulated in the bodies through your kidneys, and it helps your body's fluid balance. I think the biggest thing is knowing that all salts, again, just like everything, are in moderation. I did once talk to a group of kindergarten and first graders who I told them that salt was unhealthy, and they went home and threw their salt shakers away at their house. And so I got a call from the principal the next day asking what I said to the kids. But you know what, it stuck. And they said that Miss Tracy said that salt's not healthy and they all want to be healthy. But truly, again, just in moderation, just know that there's salt in just about everything that we're eating. So adding in extra salt to things sometimes is just to be very cautious of that from that perspective. So all the things that we've just talked about is how we can focus on healthy living for ourselves. And when we're setting that guideline for ourselves, whether we're the ones that are cooking dinner or that are really kind of that advocate for our families, we've talked about how a lot of things that we control for ourselves that then put us in a place to do that for our families, and how we can live healthier lives together. But what about our community? How can we truly create the healthiest community together? So what I know we've been talking about a little bit of, and what the Heart Association is really focusing on, is how your health is so deeply connected to social and economical determinants, like wealth, education. Some estimates that it can really control about 40 to 45% of your health outcomes from those areas. So we know that when we have, good health, wealth, and education from that perspective, it really is that great piece to put us at a higher potential to live a longer, healthier life. And so when we think about what makes up a healthy community, it really is how we build that culture of health. All of the systems in our community really have to work together for a community to thrive. Yes, the Heart Association is one, nonprofit in the area. What we're really trying to do is just work together so much more to pull in what each organization is doing best and work together to help our community thrive. Health is both an outcome and a determinant, and it means that everyone has to have a role and play a role in helping us building a culture of health. So you can see like all of these things on here are just really what it does, what makes up a healthy community from that end. So for an example, access to healthy food can definitely impact a family's health. So I actually live and reside in Lordstown, Ohio. And until about 3 years ago, I never realized that I live in a food desert. So there are no grocery stores in Lordstown. There are maybe one farm stand that is still about 4 miles or so from my house. So if I didn't have reliable transportation, if I didn't have a car, there's absolutely no sidewalks in Lordstown. I think there's one around the school. And so when I think about what it could mean for somebody who doesn't have reliable transportation, there is no way for them to truly get not only, fresh food, but healthy options and things like that, besides whatever is on the store, whatever's on the shelf at a local convenience store. And thankfully I have, that car, that reliable transportation, but there's people here that don't have that. So what can we do to change that? Many aspects of daily living do affect each person to live healthier. For me, grocery shopping is a simple task. For others, it may not be. So what I talked about a little bit ago was kind of the average life expectancy. So this is actually somewhere in New Orleans. So there's a couple of different areas, and some suburbs as well. And so if you look, the difference in life expectancy is over 25 years in some of these areas, just outside of the city. And so how do we make sure that we're closing that gap and not making sure that people are experiencing that living just miles apart from each other? So these are just some ways that the Heart Association is trying to make a difference. Working on to address food deserts in our communities, encouraging through our Kids Heart Challenge, healthy physical education plans and meal plans for the kids at the schools, working with the food industry at large, just focusing on lower sodium. So whether that's food that is served to patients in the hospital, whether that is on our college campuses, whatever that looks like, is just working with the food industry from there. Being active in our community that promote healthy living. So whether that is safe streets or, playgrounds or just different things like that from that perspective. Working on developing prevention and control programs in the communities to help people and meet people where they are as far as educating them. And then ensuring that communities have a strong healthcare system through our guidelines program so that wherever you are being treated in the community, that the guidelines and the standards are consistent across the board for what tests you get within a matter of time and all those kind of things is something that we work with pretty closely on. There's a couple things that you can do from that perspective. There's just to really make a difference in your own heart health and in your community. So if you want to know kind of what your heart check score is, there is a free site that you can go to. It's mylifecheck.heart.org, where it will ask you a slew of questions about your lifestyle, about family history, about those kind of things. And it will give you your life check and kind of then be there to help you to see what areas of opportunity that you could use a little bit of help with, and that resources that the Heart Association can give you as well. The second thing is what is our You're the Cure network. And really this is our advocacy avenue for all things Heart Association. So when I talked a little bit ago about telephonic CPR and our stroke registry, so one thing that we have legislation that we're backing right now is that each 911 operator would be trained in how to talk through and teach someone hands-only CPR when they're calling in on the other line. That is not a requirement right now for the operators. So we want to make sure that that first call that they're making and that first step of the chain of survival, that someone is able to talk somebody through how to do hands-only CPR. Again, the placement of the hands, where to push, all those kind of things, and really talking them through that first step until help arrives. So you'rethecure.org really allows anyone in the community to be able to contact legislators. And what's really great about this is once you sign up once, put in your address and information, it connects you directly with your local lawmakers. So there's no kind of searching, there's no anything from that perspective of not knowing who to contact. This site will do it for you. And then it'll send you emails about updates and things like that that are taking place in the community, that if it's something that you support, that you can support as well from that perspective by just sending a quick email, making a phone call to local legislation, things like that. So just two things, one for yourself, one for your community that you guys can try out if you'd like. And that is the end of all the things that I talked about today. Like I mentioned earlier, the biggest thing is doing something, starting small, starting somewhere. If you could take one little tidbit of information away today and put it into practice, is better than what happened yesterday. And so that's what I always think is how we can do 1% better and just starting somewhere and starting small. So thank you. I will stop talking. And if there's any questions, please feel free to put them in the chat, or Donna, however you guys handle it.
Yes, Jess, if you want to turn off the recording and we can open it up for questions.